If you or a loved one are dealing with ulcerative colitis or Crohn's disease, you've probably heard about Entyvio, also known as vedolizumab. In this video, we're diving into the top 10 essential facts about this groundbreaking treatment. We'll cover everything from how it works to its effectiveness, safety, and what you need to know about managing your treatment. Number 1. What is Entyvio? Entyvio, also known by its generic name vedolizumab, isn't just another medication for ulcerative colitis and Crohn's disease. It's a specialized biological therapy designed to target inflammation specifically in the gut. Unlike some other treatments that affect the entire immune system, Entyvio hones in on a specific protein called alpha-4 beta-7 integrin. This protein plays a crucial role in allowing certain white blood cells to migrate into the inflamed tissues of the gastrointestinal tract. By blocking this interaction with MAdCAM1, Entyvio helps reduce the chronic inflammation that characterizes conditions like ulcerative colitis and Crohn's disease. This targeted approach is why it's considered a selective immunosuppressant, focusing on the gut rather than causing widespread suppression of the immune system. Number 2. How does Entyvio work? Understanding how Entyvio works sheds light on why it's effective yet different from other treatments. Essentially, Entyvio binds to alpha-4 beta-7 integrin on the surface of T lymphocytes, preventing these cells from entering and causing havoc in the gut lining. This targeted action means it doesn't suppress the immune system throughout the entire body like some other biologics might. Instead, it specifically addresses the gut inflammation, which helps in managing symptoms like abdominal pain, diarrhea, and fatigue that are common in ulcerative colitis and Crohn's disease. This mechanism not only sets it apart, but also makes it a favorable option for patients looking to manage their condition with minimal systemic side effects. Number 3. Who can benefit from Entyvio? Entyvio is approved for use in adults with moderate to severe ulcerative colitis or Crohn's disease who have not responded well to conventional therapies. It's particularly beneficial for those who require a treatment that targets gut inflammation without compromising the entire immune system. Typically, patients undergo an initial induction phase where Entyvio is administered via intravenous infusion over several weeks. This phase helps kickstart the therapeutic effects. Afterward, maintenance therapy involves less frequent infusions, usually every 8 weeks, or alternatively, patients can opt for subcutaneous injections at home using a pre-filled pen. This flexibility in administration caters to different patients' preferences and lifestyles, offering convenience alongside effective disease management. Number 4. How is Entyvio administered? Sitting comfortably in your doctor's office or even at home receiving an Entyvio infusion that lasts about 30 minutes. This initial phase is crucial to build up the medication in your system and start managing your symptoms effectively. Once you've completed these first few infusions, which are spaced over a few weeks, you can transition to a maintenance schedule. This might mean fewer visits to the clinic as you settle into a routine of infusions every 8 weeks or self-administering with the Entyvio pen. The goal is to keep inflammation under control and reduce the need for other medications like corticosteroids. It's all about finding the balance between managing your condition and maintaining your quality of life. Number 5. How effective is Entyvio? Entyvio doesn't work overnight, but it's known to make a noticeable difference for many patients dealing with ulcerative colitis or Crohn's disease. After starting treatment, some patients may begin to experience relief from symptoms like abdominal pain and diarrhea within a few weeks, though it can take up to 6 weeks for the full effects to be felt. With continued therapy, Entyvio has been shown to significantly improve symptoms, induce remission, and even allow some patients to reduce or stop their use of corticosteroids. Clinical trials have demonstrated impressive results, with a significant number of patients achieving clinical remission and maintaining it over extended periods, which is crucial for long-term management of these chronic conditions. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. Number 6. What are the safety concerns with Entyvio? Now let's address the elephant in the room: safety. Like any medication, Entyvio comes with potential risks. While it primarily targets gut inflammation and isn't a broad immunosuppressant, it still carries a risk of infections. Common side effects include headaches, nausea, and fatigue, while more serious concerns like liver problems and allergic reactions can occur. That said, strict monitoring during treatment helps catch any issues early on, ensuring prompt intervention if needed. It's also essential to be vigilant about infections and report any symptoms promptly to your healthcare provider. Understanding these potential risks allows patients and healthcare teams to work together to manage them effectively while reaping the benefits of Entyvio's targeted therapy. Number 7. What medications interact with Entyvio? When it comes to drug interactions, Entyvio is no exception. It's important to know that certain medications can affect how Entyvio works or increase risk of side effects. For example, taking TNF blockers like adalimumab or corticosteroids such as prednisone can heighten your risk of infections. Herbal supplements like black cohosh and other immunosuppressants might also interfere with Entyvio. Live vaccines, like those for yellow fever or measles, should generally be avoided unless your doctor gives the green light. Always keep an open dialogue with your healthcare provider about all the medications and supplements you're taking to ensure there are no harmful interactions and to manage your treatment safely. Number 8. What should patients consider when using Entyvio? Entyvio isn't a one-size-fits-all solution. Its use and effects can vary based on individual patient factors. For seniors, children, pregnant women, or those with other health conditions like liver or kidney problems, special precautions might be necessary. Pregnant women, for instance, should weigh the benefits against potential risks. And they are encouraged to join a pregnancy registry to help gather more information about Entyvio's effects during pregnancy. It's also important for patients to stay on top of their vaccination schedules before starting treatment. Regular check-ins with your healthcare provider are essential to monitor your progress, manage any side effects, and adjust your treatment plan as needed to ensure the best possible outcome. Number 9. How much does Entyvio cost and is it available? Navigating the cost and availability of Entyvio can be a bit of a journey. While it's widely accessible through most healthcare providers, the cost can be a significant consideration. It's crucial to work closely with your insurance company to understand your coverage options, as Entyvio is a specialty medication and can be quite pricey. There are no generic versions available yet, which means prices remain on the higher side. However, many pharmaceutical companies, including the makers of Entyvio, often provide financial assistance programs to help alleviate some of the costs. Don't hesitate to ask your healthcare provider about these programs, as they can make a big difference in managing the financial aspects of your treatment. Number 10. What does the future hold for Entyvio? The world of medicine is always evolving, and Entyvio is no exception. Ongoing research aims to expand its use, potentially bringing relief to even more patients. There are studies exploring new indications and better understanding its long-term effects. Innovations in drug delivery and formulation may also enhance patients' convenience and adherence. Patient advocacy groups and educational initiatives continue to grow, providing support and resources for those affected by ulcerative colitis and Crohn's disease. Staying informed about these advancements can empower patients and caregivers, offering hope and a clearer vision for managing these chronic conditions. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. And cheers to a healthy life!